we're gonna keep this for ourselves, and then I'm gonna share it with just the class.
And likewise, you added in points from what we had discussed that I wanted to write in, I just didn't write in. All the things where you connected like Langbear to what I was saying about how he just wanted to fit in, for example. I didn't have that written down originally in my first draft, but you helped me connect those.
Right.
So I've learned through the edited draft too. You guys can definitely learn about what you're writing through his editing.
Right. Excellent. So I think we're joined by Professor Centurion. Ingrid, yeah.
Yes. I just renamed me on there, so you can got me correct there.
That's fine. So Ingrid, we are discussing my work as an editor, which, by the way, I had to work very hard to acquire. Okay, that's a skill I'm very, very proud of because I didn't have it at the very beginning when I first, wrote papers in English. They were okay, but they were not great, and I did not know why. And I had to go to a couple of editors, and the same thing for the translations I did. The first translation was, a horrible experience because I did not know what I did not know. And then it took me, a bunch of what I would call cold showers, probably 15 of them, and not pleasant. A cold shower is not exactly pleasant. And in any event, I did learn how to write in good English, and I can tell what it is that flows and doesn't flow. So in the end, I became a very good, a good editor. It's always better or easier to help somebody with their work than your own work. I'm helped by somebody looking at my work and saying, get rid of this. How about talking about that thing at that point? So this is essentially, Danny, what I did for you. I knew what had to be plugged in, and I knew how to make it run much more smoothly, and this is what we did. Okay, so
Sure.
Now your collective wisdom or your collective knowledge adding up to wisdom. I want Esther, because I talked with Esther this morning. Esther texted me and said, I could not do one thing that I wanted her to do, and I said that's okay. And she explained to me something that is incredibly important. I want you to hear what Esther has to say. So Ingrid, this will be actually very interesting to you too. So Esther, go ahead. Esther, can you hear me?
Oh, it's me?
Yes.
Oh, good morning, everyone. Can everyone hear me?
Yes.
Yes.
Oh, good.
Yes.
Yep.
My name is Esther, one of the students, and I migrated from Africa like 10 years ago with a family of 5, and I was a nurse. I don't know how to pronounce, but a nurse in Africa for 16 years.
Wow.
And then I came here, I read some books, some classes, and I did my board, and I was given a license to practice in here. So here I have been a nurse for around 10 years. In Africa, I worked in hospitals, maternity, theater, pediatric, in every unit of the hospital setting. But here, I opted to work in to deal with geriatric, that is nursing homes. So I have been working in the nursing homes for the last almost 9 plus some months, years. So, and I like it because I like dealing with old people. So, in my nursing home, I won't say a name. I have been working here until this pandemic struck. I have come face to face with COVID patients. I have taken care of them. The first 2 cases, I took care of them like a month ago. And I was so scared when it started spreading. So we had 2 cases, then 4 cases, 6 cases, then it went to 8. So that's when the CDC decided we all needed to be tested. So they sent National Guard to come on. They came in April 25th. It was on a Saturday. And all the staffs, all the patients, we were tested. And we were so scared. I was so scared. I didn't want to get sick. So my test came back negative, and I was so happy because I took care of the patients, and I thought maybe I'll be one of the positive ones. But we had like 19 positive staffs, 34 patients. I'm not saying the name of the nursing home for protection. So now, 19 patients, 19 staff being sick, we were short of staffs. So since that time, like 2 weeks ago, 1 week and some days, we have been working so hard because we don't have enough staff. We have so many cases of sick patients. Some of them, we are sending them to the hospital. For now, we have 5 deaths from COVID-19. 5 patients have died. We have 8 patients in the hospital. Some of them are doing well because 3 of them have come back, but some of them are on ventilators machine. So like on Saturday, I was supposed to submit some homework to Dr. Gedry, but I was not able to do it because on Saturday and Sunday, weekends are always so hard to get staffs. So on Saturday, I went to work from 3 p.m., that was Saturday, 3 p.m., up to the following day, 9 a.m. That is more than 16 hours shift. So I came home, I took a shower, I went to bed like for 4 hours. I went back at 3 p.m. and Sunday morning I left around 10. That is almost 19 hours. So yesterday I was off. I didn't do much. I was so exhausted. So I was telling Dr. Gedry, I slept almost 10 hours and I felt so good. So I have come face to face with COVID patients and they are really suffering because the first fever, we are checking like 5 symptoms. If a patient has fever, that is one sign. If they are vomiting or they have diarrhea, that's another one. If they are coughing, a cough, poor appetite, all of them. And most of the patients who tested negative, they are coming back to be positive if they present with those symptoms. So our job as healthcare workers, we call the doctor, we get the order to do the COVID test, and some of them are positive. We are trying to contain it, but with these elderly people, some of them are confused. It's so hard to contain them in one room. So that's why in nursing home, you see there is so much spread of the virus. But we are really trying. And for us staff, we have personal protective equipment. We wear masks, goggles, and the apron, the gown, when we are taking care of them. And the mask is mandatory. And we are not using the regular mask because the regular mask, the surgical mask, the one the surgeons wear, that one doesn't protect you inhaling the droplets, the infected with virus. So we are using the one they call N95. That one is good because it filters the air which comes in. But the other one doesn't prevent the air from which comes in. And this virus is funny because it likes the mucous membrane, so it can get through the nose, the eyes, and the mouth. So when it gets there, that's why it's getting access to the bloodstream. And mostly it's going direct to the lungs. And when it gets to the lung, to the lungs is taking over the work of the cells of the lungs, and that's how people are not able to breathe better. So we are trying. I have been off yesterday. Yesterday was Monday, and today I'm off. Tomorrow I'm doing a two shift, double shift, 8 hours, 8 hours. So tomorrow I'm going there at 3 p.m. and until the following day. So we are eating healthy, staying safe, all the precautions. Mostly we are using the Lysol and the jig, the bleach, Lysol bleach to disinfect the areas and the gloves. So that's how we are keeping healthy. And I'm so happy to be healthy and I feel strong. Yeah, unless if somebody has a question, that's the end of what we are doing right now. So in our facility right now, our facility holds 145 patients. And right now we have like 108. So the census has gone down. Yeah.
Excellent, excellent. You've done an excellent presentation. In fact, it's so good that I would like to ask somebody, whoever it is, to transcribe it, because on this basis we can add more to it. You know, like later on, you gave some extremely helpful criteria for thinking about you know, how to operate within this environment. So that would be very helpful to work on this sort of work in progress for us to, meaning our class, but you know, it could go beyond the class too. You know, we keep it all confidential, so no name pops up, but basically you have knowledge that the rest of us don't have, and therefore I think it's extremely helpful to continue. There are some people who, I mean, one student says that the student's test is positive for COVID-19, and she also says she lost one of her patients 2 days ago. So this is obviously somebody who also is a nurse and validates, you know, the fact this is an extremely contagious and extremely serious ailment and virus for the populations at risk. And the populations at risk are the elderly in these nursing homes, right? I mean, this is essentially what it is. So, okay, let's just ask some, you know, so Esther asked if you guys have any questions to ask. You know, if you have any questions to ask, please ask them now, either through the microphone or in writing, and I will read them.
Okay.
I mean, I just want to repeat the main point,
Yeah.
is that you had 145 patients 2.5 months ago or 2 months ago, and now you're down to 108. Some are in the hospital. You said now you have currently 8 in the hospital.
And we are not admitting any right now because of the outbreak.
Yes, right. They're not admitting, oh yeah, the nursing home is not admitting any.
Yeah, until we clear the pandemic.
But you also said you had 5 people dead.
Yes.
From the 145, 5 are just dead, period.
Mm-hmm. Yes.
Did they die in the nursing home or in the hospital?
3 of them died in the nursing home and 2 in the hospital.
Right, okay. Now, I also jotted down the 5 factors. You said fever, vomiting, coughing, poor appetite. What about aching? You know, I think I've heard people saying, you know, their joints are very tough, and Professor Sanchez said that yeah, he felt that too, because he tested positive, as you may recall. He was on the call. Yeah, it was a Thursday. So you heard? Did you hear him, Esther, Professor?
Yeah. He said he had joint aches.
Yes. Okay, so all these factors. Now, one more question for you, Esther. Do you have this mask that you could show us the mask, that the L95 mask?
Yes, I do. Hold on one second.
Okay, so I won't ever see. I have
I
never.
think it's the M95 mask.
I'm sorry. I heard L. Okay, so
N. Oh, N is N. Do you want me to get it?
N like Nicole.
Yes, it's
Okay.
N.
Or Noel or Niagara or whatever. Okay, N95. Do you have it to show it to us?
I have it in my car.
Oh, your car. Okay, that's fine. That's fine.
Yeah.
But next time you show it to us, okay?
Yes, I will.
Does it have these things on the side?
Yes, it does. But the regular one is, yeah, it does.
Okay.
I have mine. Let me go get mine to show you guys
Yes,
because
please. I mean, it's expensive probably to get, right?
well, you can't find any. Is the next thing out there as well.
No, I'm sure it's hard to find, and I'm sure it's pricey. I can only imagine it's expensive, right? Do you know how much it is? Okay, Tyler says, I have experience with those. They work incredibly well. Okay, Tyler, just how expensive are they, these masks?
So Alec is asking whether we can use N95 for long. Yes, you can, as long as it's tight enough, because they are really expensive. You'd rather reuse it than do without. So when we are working, we are using it 3 to 4 days, unless if it's not tight enough. That's the time you can change it.
So Ingrid, this is the N95?
Yes.
See me?
We get, but this is not what Esther said. Esther said the N95 she has these little breathing, so to speak, on both sides, correct? No?
It has strings, 2 strings,
Okay.
and it holds tight in your mouth.
Yeah, I can't see the.
Well,
I
you're
don't know what happened to my screen.
Ingrid, the lighting behind you, or the lighting. Oh, that's better. That's much better.
Can you see it now?
That's much better.
Yeah.
Oh yes, that is the one.
Yeah.
Okay, this is the one.
Yes.
And it says November 95 on it. And it's nice and tight. It has 2 straps. It goes around the back. I got this from my sister because her husband works for the city of Chicago, and this is the required one. I could see how this is excellent. This really stops anything from entry.
Yes.
Nose.
And it's hold so tight.
Yes, nice and tight.
Okay, and
Yeah, at the side is written N95.
Yes, it is written N95 right there.
Yeah, that's the one.
So what's interesting is that, you know, if this is what's preventing, you know, the molecules, all these other masks are substandard.
Yeah, these are the surgical masks, the ones which the surgeons use when they are doing operations. And those ones are to prevent anything going to the patient. So they don't filter the air from outside.
the purpose, exactly, the purpose is to prevent
infection from the
mouth of the operating doctor or surgeon or nurse to the patient whose body is opened up. So obviously they don't do the protection of the person who wears the mask by a virus, which is extremely small and extremely contagious.
So Esther, I have a million questions in the nursing facilities. Were all the patients wearing N95 masks?
No, they are wearing the surgical masks.
Right.
But what we are doing to contain it, we are making sure they stay in one room, especially those who are infected, they can stay in one room. Those who are not infected, in one room. If they come out, we are giving them masks to wear.
Okay.
Yeah.
And they just have the freedom to move out, or you said they're often confused. Did they wander out of the rooms, and that's why it's hard to contain?
Some of them, because we have different units. We have units with dementia patients.
Man, God bless you.
Yeah, dementia patients, those ones are so hard to contain in one room. They are moving around. They don't know why you are telling them to wear masks.
I
So
believe it for sure. I can see
yeah,
that right now.
so that's where that's where the infection is so much. But the other units, they understand, and
Sure.
we are able to contain it.
Wow.
Yeah.
You know, before this pandemic occurred, we were short 1.2 million nurses in the United States of America.
Mm.
We're short 1.2 million. And I know that because I'm always trying to help people find jobs, look at what career they want to get into the future. And, you know, the getting your nursing certification is a lot of work. You have to study, you have to pass the test. And this country, before this occurred, we were short 1.2 million. You know, it's like pilots. You all know that I'm a pilot.
Yeah.
And the being a pilot, we go through, sometimes we're short pilots because many of them retire, right? So the industry's like, hey, you know, this is an industry you want to get into, go learn to be a pilot because you're definitely going to have a job. And it's amazing to me how going into this and that we're short that many people. And it floors me that, you know, if we're going to get back to normal, there needs to be a plan to have nurses and caregivers and have this industry. There's the jobs right there.
Absolutely.
Yeah, but you know, most of people don't want to do nursing. Like my 3 kids, none of them want to join the health profession. They don't want. They say they can't take care of the people. It has to come from your heart. It's a passion, this one, because this one is not, right now, it's not about money. It's about the kindness and the commitment. Although they are giving bonuses, it's not worth, like, I won't say risking your life, but you have that heart of helping.
That's right.
Yeah.
And, you know, and I could make the same comparison with, you know, a lot of people, they say they want to be pilots, but once you sit in that seat, you're responsible for people's lives.
I know, you know, like, it's true. When you are dealing with somebody's lives, it's not like a mechanic or an engineer who is working with machines and everything. You are dealing with lives. It's different. And they say, like, I'm not trying to praise myself. The nurses, they are the most important people in the health profession because they are like the backbone. They are the first one to see a baby comes in the world, and they are the last one to see a person die. So
Right.
Yeah.
when people come in life and then people are dying, they are in the hearts of the nurses.
Right.
Yeah.
No, I agree with that. It seems that just like we had a Peace Corps movement that created, you know, volunteers of work, maybe we need to have a health corps movement.
Yes.
You're going to be, at some point, I think Ingrid is going to be the governor of Massachusetts. Really. I honestly believe that. You know, if you just I give you 10 years and you're going to be the governor.
You know, it's just taking care of your children, being a mother, taking care of your family. This all requires compassion. Being a nurse requires so much compassion and care for others. That's what we need more of.
I agree, but we need to find the institutional framework for these budding, you know, people, like young people, like these kids on the call, to do something, to have something to do, to sort of get into. So I think putting a motion for a bill to increase dramatically, like tenfold, the recruitment of nurses with, you know, a total commitment, a sort of existential commitment to the cause, not just a job, but as Esther said, a passion. That would be something to think about, Ingrid, I think.
Yes, yes. People say, okay, how do we get back to business? How do we normalize? You know, how do we get back to work? Well, right now, I mean, one great initiative would be, okay, we need this many nurses in this state so we can get back to work, so we can man the, of course, that's going to require some education,
Right.
but
But it has to have two components. Education is one thing, but it has to have a volunteer basis. So basically, the people with a passion get into it. Does that make sense?
yes.
Okay.
Yes.
So I just want to comment on a few things Esther said, because you specifically said, you know, the skills and all the rest, and you have to keep updating the skills or the knowledge from which the skills are defined. So obviously that's very important. But then also you said, you know, this sort of duty to care, the fact that these people are dying and their families are not there to even hold them. And so the nurse, in fact, is doing the job of the family. And that's a count. This is a, you know, this is what Kant would call a counsel of prudence, but it's a way of being committed to a duty of care. So it's really a combination of caring for somebody who cannot care for themselves, or the families cannot care for them, but you also know when it is you have to drop some other things that you can postpone to take care of somebody who's dying, because they're going to die within the hour, right? Essentially, that's what it is.
Yeah, that's true. Because you can see somebody's, you doing something and somebody, they say code, become brew. You have to learn to give that patient oxygen, and you try to
Right.
bring back the life, like doing resuscitations.
Okay, Marilyn added something. Marilyn is a nurse, and she says, out of the 7 friends I had the last 2 years working on getting to the program, only me kept waiting and hoping to get into the program. They all gave up and changed majors. Wow. Marilyn, you could explain this maybe with your mic, or you want to add, because so they get, okay, Ingrid commented, they gave up because it was difficult.
Yes, I know several people that started the nursing program, and apparently it's challenging, it's tough. And these were great people who care, who have the heart and the compassion, but maybe they didn't have the you know, the book smarts or something like that. And it's a shame, but they went through the whole program, like Marilyn was saying, and failed the test. And I wish there was some.
That's how, in my view, okay, this is, I'm totally looking at this from the outside. It seems to me there's value in having a higher, maybe, access, a more difficult access into the program. In other words, you have to test in, you know, you have to test into the thing at a fairly high level. What it is, whatever it is, maybe it's chemistry, maybe it is, you know, figuring out percentages and stuff like that. So if you cannot figure out the percentages and how to do a computation within a minute, because basically it boils down to that probably, you can't have the, you know, you don't get into the program. Does that make sense what I'm saying?
Yes, and I was saying that, like me, I'm not a nurse yet, but I'm a caregiver in a group home, so I have some certifications like home health aide and CNA, and then a MAP. I'm allowed to like pass medications, and I've been working on getting into the program since 2017, and I've met the requirements, and I know I can do it, and I don't know, I don't know how it works because I'm really new into the country. Also, I was already in the medical school for 2 years back in my country, because when I finished at 17, I went straight to a medical school, and I spent 2 years that I didn't complete and came over here. So I don't really know what is the issue, and I can't really blame the system, and I don't really know. I always try to figure out, because I feel like there's gotta be something, because like my own example, I am ready, and I know most of the students that my friends were very smart, like book smart, but they gave up. They were like, this is too much. This is too much for me. This is too much frustration. I don't want to have this frustration to get into the program. And they just gave up. Like one of them gave up last year. And like just to get into doing the TEAS test, which is the test required to actually get into the program, which is about like 270 questions that you have to do in about 2 hours and 30 minutes. And it wasn't because I was not smart that I failed this test at 2 times, but it was just like it felt like it was about how much you can get done in that time. So it's how quick you can be. And I don't know, it was just like my friend failed it, they all failed the test, and they gave up. One is now doing radio tech, and he was just admitted, and I am still not admitted, and hoping that maybe I'll get admitted in 2021. And I've been waiting since last year. And I have a friend also who started at Revere University, and she failed her first semester and came to Middlesex and had to wait for a few months before she get admitted. She was finally admitted and went through 2 semesters, and finally this semester she has been kicked out because she didn't meet one of her classes, or she was going some mental problems and family issues, and she didn't meet it. I don't know, I still feel like the girl who's very like she's very a studious girl, and I feel like she deserved that second chance. She deserved that. She deserved that, at least that chance to not being kicked out, and just at least redo the class again and keep on moving with it, which I think she could have been a great nurse because she works at Lowell General and she has been there for a while now. So I don't know. I don't know how to really feel about it. Thank you.
Very interesting testimony, Marilyn. Excellent, excellent. It seems to me, again, looking at it from the outside, that the program could be redesigned to make, I mean, you have to have people like Ingrid who know how to structure a corporate environment, because this is essentially a sort of pre-corporate environment, and look at it, how it's done now, how it works, or it's supposed to work now, and in fact, it's not working. And Ingrid, do you think you could do that?
You know, I think that the medical industry in America is very strict, very regulatory. I know that the nursing program is very challenging. And I mean, I would rather be taken care of by my mom, who has no education, because I know she's going to be there for me. So there needs to be a balance between, you know, all this data and actually caregiving. I mean, I understand there's certain things that nurses probably need to know, but then there's, you know, the nurse's assistant or a caregiver. We should have, there's so much to do when you're taking care of someone 24/7. Esther knows. And it's tiring mentally, physically. I know so many nurses and caregivers that throw out their backs because they have to lift the patients. You have to be strong. And we need to do a better job of caring for our elderly. And it's obvious that we are not doing the best that we can from what's occurring in these nursing homes.
Danny Lessard wrote, "It does sound like the system is to blame."
When it comes to nursing, it's so strict because what they argue is that when you are learning, you need to pay attention. I'm not saying they don't, but they say we need to know a lot because we'll be dealing with lives. It's not like mechanics or engineers. That's why they become a little bit strict, because when we get out to practice, we are dealing with lives, and lives are more important than anything else. But don't give up, keep trying. I have seen a nurse who did nursing for 7 years and she didn't give up. And now she's a nurse. She has been a nurse for the last 12 years. So in life, never give up.
That's right.
Like I've been offered to give up so many times. Like even at this point, I'm just about to give up on it, and because I've been waiting for so long, and next semesters I don't know if I have to go to school because I have no more classes to take. I finished all my prereqs since last year, like since last year spring, and I completed my liberal art and science degree. Right now, I'm gonna graduate this May, and it's like I have nothing more to do, and I'm losing all the financial aid found credit that I can have, and I'm not getting anywhere. At some point, I just feel like I need a sense of accomplishment, and I've come a long way, and it's just like you don't have it, you don't feel it, but that's just personal. Talking about having the mask, and I really wish that I had all this equipment available to me at my group home so I wouldn't catch the disease. So I was literally, when I lost the patient that I lost, because we only have 4 clients at the house, and when the pandemic started, we didn't get masks. We didn't get none of that. They didn't give it to us until like in maybe I'll say since March till now, they gave us 2 masks, which is not even the N95 that you guys were just talking about. And my client who passed away, I still have like this kind of I would not say I'm more mad than sad, because I feel like there was a way to prevent it, because when we all caught the virus from somebody who walked into the house with the virus. Personally, I didn't know it was the virus at first, and when I felt wrong and I started taking care of myself, like drinking the hot tea and taking a Dayquil and NyQuil and Mucinex and all that, but my client at the place didn't get none of that. And she's the first one that they took for testing. I actually got tested later because they had to plan all that. She got tested first, and then they had to call her doctor, who had to send anything for like a fever, her pain. She didn't receive none of those medication on time, and as soon as the fever was lasting for 2 days, then she got sent to the hospital, and she never came back like 3 days after she passed away. And I'm like, she tested positive. The whole process of getting her medication orders or all that, she didn't get all that. So eventually, what would the disease do to her? She was already 65, and I'm like, so eventually she was just gonna fall into that.
Sad.
Very sad. But you
No,
know,
I think we're going to all look back on all this, and I think that keeping quarantine everyone may not be the best thing, because you're letting.
well, keeping everybody in quarantine is the right thing, but to have the right procedures for these individuals who are in these nursing homes, for sure, that has to be kept very high. And the testing, right?
Yeah, I agree with you, Doctor.
Danny, excellent. I think Danny has some excellent ideas that we could work on. I mean, I can help from a distance, but I think just figuring out how to shape it correctly. Now, during the weekend, Danny came on board with a Zoom conversation I had with Dr. Madden from originally Massachusetts, who's now in Florida, Sarasota, Florida. And so the two of you, Esther and Marilyn, if you would want to ask him questions about how to pursue your future as nurses, he might be able to give you some sound advice.
Well, maybe without even asking questions, I would definitely encourage you to never give up. But by the sounds of it, it seems like there's some clerical issues going on behind the scenes that could relate to the system just holding her back from being placed into this nursing program. And I don't know anything about the nursing program. I'm assuming you guys are referring to the nursing program at Middlesex. I know that there are other schools that have way bigger nursing programs. Bunker Hill Community College in Boston, for example, has a renowned community college nursing program. If you're able to get to Boston, UMass Lowell has a very good nursing program. I mean, I know there's other options where it tends to be maybe you have a little bit of a better chance to get into because they have more developed or better developed programs. That's all I'm aware of.
Excellent. Well, that would be local, that's for sure. That's the first thing to do. But I think that might be, outside of Massachusetts, because the point that Dr. Madden made was that the way in which the medical care has been structured in Massachusetts essentially makes it very difficult for doctors to do what they're supposed to do. And that was because of ACA, Care Act. So he has a very, extremely extensive perspective on what it is that has happened in Massachusetts that actually forced him to take the hell out of Massachusetts.
Sure.
I'm just saying, Danny, you're right.
Yeah.
Sure. These two students here, your classmates, they would benefit from investigating those two colleges you mentioned. But ultimately, long term, until or unless Obamacare is replaced, they have to think of long-term other options too. I mean, options, not other options, options. So if you guys are interested, Ingrid, you were on a call once with Madden, right?
Yes. He's great.
He's great. He's really great.
Now that we understand the mask, I don't know if everyone on the line understood the proper masks that need to be worn, but I wanted to know how the students feel about, the governors ordering you wear a mask and then the fines that are being imposed upon that. Now that you know what is a good mask, what is a mask that doesn't offer you the proper protection.
We're going to explain where the governor has. I mean, the governor is not saying in your bathroom or in your bedroom with your wife you have to, or husband, whatever, you need to wear a mask. What is the governor saying exactly?
In public places, you have to wear a mask, and in
public places in Massachusetts.
And in some towns, they will not let you into the store. They won't take.
Okay, that's a privilege of the store. That's slightly different. But you walk down. I've seen. The reason I'm asking you is because I know that in Peabody, if you don't wear a mask on the streets of Peabody, you are fined $1,000. Now in Beverly, no. Yesterday I drove between Salem, and in Salem the same thing. People weren't wearing masks. Some weren't wearing masks because they chose to, but not everyone was wearing a mask, which means that Salem is not giving a fine of $1,000 to people who are not wearing a mask. And likewise in Beverly, some do, some don't. So I cannot imagine. I mean, it's hard for me to imagine that the governor, who sometimes is okay, sometimes is not so okay, is coming up with something which to me sounds crazy.
What do you think he's going to do? That would be crazy.
Repeat it again. The governor has no jurisdiction over what it is that Walmart or Market Basket or whatever, Stop and Shop. These stores have the privilege of saying you don't enter unless you wear a mask, right? They have the privilege. Now, the governor cannot change that. But I don't think the governor would be well advised to say we need to have a mask in all public places in Massachusetts. I mean, unless he says public places means city halls and town halls and federal, state courthouses, right? I mean, then that's okay. I think he has the jurisdiction over these things, or he can try, I suppose. But I don't think he can go as far as to say.
He has. It says the Baker Polito issued requiring the use of masks or face coverings in public places where you cannot socially distance. They ordered all residents over the age of 2 to use a face covering or mask in public places where maintaining proper social distancing prevents You know,
Right, but the clause that clause is very important in the sense that, you know, basically beaches and streets where you can do the distancing. So okay,
the
so it means
statewide order goes into effect May 6th.
right. So this would mean that the colleges, the
Wait,
classrooms would probably have this. So go ahead. I mean, I was trying to figure out the, you know, what the language of the governor's thing really meant. Go ahead, Danny.
I just wanted to ask Ingrid. So everyone over the age of 2 as of tomorrow has to wear masks when they leave their house, essentially.
Yes, wherever you cannot
Okay.
maintain social distancing.
Right.
Okay. So if,
I saw a lady running down the street and she
yeah,
had, I'm like, why is she wearing a mask? I mean,
Right.
that's hard
But,
for
her choice, but you know, she's not legally bound to do that.
until
No.
tomorrow.
But
Until
tomorrow, if she gets into a position where she cannot establish social distancing in public, whatever that means, you know,
Yeah.
even on the beach, she would be fined, or she would whatever. Well, but by the way, is there a fine number, Ingrid?
I'm looking right now. I don't see the cost and the fine, but I'm just reading right now from the mass.gov website because everyone keeps talking about it. I'm going to click on read the order here.
Sure. That'd be awesome.
Yeah,
So, yes, yeah, mask and face coverings. And it talks about, you know, what constitutes a mask and face covering.
Interested. So
yeah.
but-
You have to see the 10th Amendment of the U.S. Constitution says basically the states have the right to do these things, in as much as whatever, you know. But basically the governor has the right to do that. And then what we, the people, have the right to compare and contrast.
Okay, I'm reading the order right now. It does say here, violation of this order may result in a civil fine up to $300 per violation in the manner for non-criminal disposition of violations. Order effective Wednesday, May 6th, signed Governor Baker, 9:30 on the 1st of May.
wow.
So there it is. I'm reading it right from the law, and I pulled down the PDF. So everyone keeps talking about this. So
Send me, Ingrid, please send me the PDF, and then I'll post it on.
I'll post it right there on the side so everybody can read it.
Yeah, that's true.
I wonder what they define a public space where you're unable to. So, because I would assume that's what the like Stop and Shop and the grocery stores have already been doing. You know, like inside of stores, that's a public space where you can't social distance.
Not quite, Danny. Danny, it's not exactly a social. It's not exactly a public place in the sense that the governor does not.
Right.
It's a private space, but
Right.
the public can go into it, and they have the right to define how people are going to enter it, because the governor has given directives which they have decided to agree and to follow. But the bottom line is, your question, Danny, was excellent, because what is it that is a public place? I mean, really, if you think of it, okay, you go to the beach. I mean, I'm really pissed at Baker for having closed down the beaches. And
Dude, I live on Cape Cod. You don't even know. It's unbelievable.
right. No, I agree. And by the way,
Should be shut down.
I might
Everything.
come and visit, you know, I might come and visit. No,
Yeah.
I'm so upset because I cannot. There's one beach that I go to all the time. It's Cranes Beach. I love it. It's just, you know, so you know, you can certainly avoid people from 6 feet. It's not that hard, you know. So the parking lot at Cranes Beach probably can have like 3,000 cars at least, maybe more. Okay. So they're gonna accept only 300. Okay. So now these cars are parked quite far apart. You will never run into contact with somebody closer to 6 feet. You will not. You just won't. And so why do they close down the beaches and all the parks? To me, it's like, you know, it's making life really miserable on a lot of people, and I think he's gonna pay a price for it, to be honest.
I agree with you, Professor, on that. I don't think I should have to wear a mask if I take my dog for a walk around the block and I'm not walking near anyone. And if anyone tried to fine me for that, I would be very upset.
And I would be very upset too, because they can also define the street as public. Okay, let's say Baker says, oh, by the way, now it's a public thing, so cannot walk on a public thing. You cannot, even come into, I mean, they're essentially assigning directions for the sidewalks.
Sure. But I'm an intelligent enough person to know that if I'm going out shopping, I'm going to wear the proper personal protective equipment, and that's by my own choice. I just know what's best for myself, and I don't need a fine when I walk my dog around the block.
Exactly, and that's why.
Especially when I have no money right now. We can't have that happening.
Right. Oh God, yeah.
So
but my next point basically is this. The governor of New Hampshire, or no, the governor of Maine is completely crazy. But let's say other governors will do much better things, and will contain, will not. Just like their states have had no major lockdown of public places, unlike Massachusetts, and they've done very well. I think they have contained the nursing homes and the like. I mean, because these were federal directions that were passed on to the nursing homes in those different states, like South Dakota and other states. So basically, I think we have to shop around. This is the Constitution. The U.S. Constitution says, hey, the states have the rights to do different things, and now you are going to be able to compare and contrast. So if Florida does a better job, maybe we have to move to Florida. You see what I'm saying? I mean, I know it's very inconvenient, okay? But it's still an option.
I'm reading. Eric T is a good point too. I mean, he says that people often disregard the 6-foot social distancing, and sure, that's a problem.
Who said that, Danny? Who said that?
Eric T.
Okay.
He just wrote it down into the chat if you want to read it.
Yes. Okay. So Eric, I'm sorry, I was so engrossed in the conversation. Eric wrote this. So one of the reasons is that people have an issue of staying away from others. Okay. I guess if you want to kiss somebody, yes. Right. Okay. Whenever I or my family was going on a walk, people passing sometimes completely disregard the 6-foot distance, and will walk either right by me or by a family member. Right.
Eric, if I were you, I would wear a mask then when you go for walks. Me, I don't run into people when I walk around the block, so I would be very upset if I got a $300 fine.
Right. No, I agree. I agree. Yeah, it makes life a little, much more complicated, because I cannot imagine how those beaches. Okay, this is a private beach. I'm getting back to that point of the beach because it's really screwing up a lot of things. See, that beach now will not reopen because they will have to monitor the fact that everyone that gets into the beach in a car has the mask, and they will have to say, oh, well, we must ask you to not park, and instead of the volunteer thing, which makes sense, and not being mandated, because you are essentially preventing people from exercising in natural environment places. And it seems to me wrong, Ingrid, to begin with.
Okay. I just wanted to get what the students think about that.
Yeah, thank you for bringing it up, and thank you for making me aware too.
I just think that the CDC is an organization that is responsible for our public health and safety. Ultimately, they are the experts. They've studied this. We've had lots of other, pandemics in the past. And I hate to place blame, because everyone wants to place blame. But the same way they always blame the pilot for the crash, they always blame the pilot for so many investigations. I want to look at this fairly, and I feel, that the CDC and everything that they've put out or failed to put out, if anyone wants to blame, that is the organization that is responsible for health and safety. And I actually have a friend that works at the CDC, and many times they don't put out accurate information because they feel they're going to scare everyone. And that's not they need to be honest with everyone. And in this situation, you know, if people want to place blame, I've been doing some research on exactly, you know, how this whole thing came down. And, you know, when China reported this on December 31st to the World Health Organization, 3 days later, our CDC offered support to send investigators to China to help out, and they denied that. On the 5th, we offered again help, and they denied that. And, you know, 11 days later, the CDC, you know, set up an incident management organization, and then they said they passed a level 1 travel health notice for travelers. And so I think that at that time, people were, you know, falling over dead in China. They were locking people in their homes. And I think that it's, you know, the leaders at the CDC that know how to deal with stuff like this. And I find, you know, if I want to place blame anywhere, that is the first step in all of this. They're the professionals that should have given us the proper guidance, and they can't make excuses when they knew what was happening in China. People were dying. People were locked into their homes. It was extremely serious.
Yeah.
And like I say, I don't want to place blame, but if you got to really do your research and see. Just like I say, pilots always get blamed for the crash, and because we're the operators flying that aircraft, which has huge responsibility for all the passengers, right? Well, the CDC has a huge responsibility of Americans.
I get the point. No, this is a well taken point that the CDC was, you know, was dealing with flawed information, which was funneled to them.
But you always have to err on the side of safety. You know what I'm saying? I can't make a decision in my aircraft that does not err on the side of safety. I think that it's the CDC's responsibility to protect.
So you're saying, yeah, no, I would agree with that.
It gets me.
I would agree with that somebody was not erring on the side of safety.
Right. I mean, they were keeling over in China.
Yeah. No, I agree with that.
Locked into their apartments.
Yeah, because of political correctness, most likely.
Right, exactly.
Yeah,
and that's where this all comes into, is about politics. And this is where politics, this isn't about politics. This is about people, you know, and their health and safety. And that is something that I don't like.
You have the media who are essentially politically correct. You cannot say anything true unless it's their line. And you have the World Health Organization, which also is completely inaccurate and essentially sold to or manipulated by China. So it boils down to, you know, keeping your eyes open and figuring out what things are you know, what things are happening or not happening. And
well, I also like this topic because I always tell you, Dr. Gendry, I like to talk about risk, you know, and as a pilot, risk management is one of the biggest things that we have to look at. Remember, we talked about risk and managing a risk and identifying a hazard and stuff like that. So when people ask, oh, you know, about the mask, well, what good is a mask if you're wearing one that isn't protecting you from the illness?
Absolutely.
That's just a show. That's just a show. That's just a demonstration. That's smoke and mirrors. If you really want to protect people, then everyone should have an N95 mask on every corner. You know, just like, of course, this doesn't, but this is me being funny, you know, like dogs poop and you go to the parks and they have the plastic bag there, right? Pick up your dog's poop. Here's the plastic bag. So you'd walk around that park and you'd think you'd never find one poop. But every time I go to California, I see a dog poop. And it's like, look, people, you're going to tell them wear this mask, and we could have N95 masks on every corner, and you're still going to find people that will not wear their mask because we're Americans. And we don't like being told what to do.
Well, this has been an interesting conversation.
And poop and masks don't have anything to do with each other. You guys know what I'm saying.
Yeah. I also agree with you, Ingrid, with everything you've said, that if there's gotta be somebody to blame, we definitely they could have handled it better. But it sounds like they prioritize I don't know, their interests or what works for them, or instead of people's safety, because they knew that people were dying in China. They knew it, and they still didn't do
Right. Right.
enough to prevent all of us. But about the order of wearing a mask right now, I'm kind of feeling 50-50 about it, because after having it and I know how it feels, I will never wish to anybody to get it. It's very horrible. Like, if you have to do anything, walk to the block. I'm begging you, wear your mask. Don't have it. Like, don't get it. It feels so wrong. Like, sometimes you sleep and you wonder if you're gonna make it the next day. And the breathing part, it's like you feel like something, like a giant cow laying on your chest.
Wow.
And you can't breathe. And now I'm like, if I knew the right mask, I didn't even know, I don't even have it. So that's why I'm feeling 50-50, because I don't even have the right mask.
Right.
So
Right.
I don't know what to do. And my doctor, when I talked to her, I'm like, I tested positive and everything. And she told me that after you broke the fever and you don't have your fever for 72 hours, you have the right to go out there in public, which I was like, I don't feel comfortable doing it, because I know I have the virus in me, and I don't even have the proper mask now that we know it's the N95 that we done. We have the surgical mask, and they say that it's lasts in the air for like 8 hours. It's like you told us, Ingrid, that they don't actually tell us the truth. Like, they
Right.
don't want to tell us exactly what it is. Like, they don't want to tell you what it is. So we like less informed. We like ignorant right now. We're just walking and we don't know what's the risk out there. And why would you tell me to go out there after 72 hours of not having a fever when I have still all the other symptoms? And
Right.
so
That,
a lot of people be walking out there with the virus. And
yeah. I think that's terrible advice that they would give you. I would say always err on the side of safety. So yes, wear a mask, but I would want you to be wearing the right mask. And I think that's the best guidance. Err on the side of safety.
Okay, I just want to read one thing that Teddy wrote. He says, I have felt the same way that Marilyn felt, feeling sick and horribly weighed down by this disease. My whole family have gone through the symptoms for the virus, and it ain't pretty. This is what Teddy wrote.
I have something to add, Dr. Gendry, before we wrap up.
Yeah.
So now I have a friend who we come from the same place in Africa,
Mm-hmm.
and she suffered malaria over there. So she has the virus now. She told me the symptoms are more or less like you have malaria, and maybe that's why they were going for that medication which treats malaria, hydroxychloroquine.
Right.
And right now, what they are using, if a patient tests positive, they are using azithromycin. That's an antibiotic.
Right.
And they are using Lovenox. Lovenox is a blood thinner because most of the patients are dying from clots, because that virus is attacking the blood cells, the white blood cells, and then they clump together, and they are the ones which are causing the embolism in the lungs. And they are invading the pulmonary veins, which transport blood from the lungs to the heart. So if those ones are clogged, the blood is not able to go to the heart, and that's how people are dying. So when the combination of antibiotic is to treat the other symptoms, like these patients are getting pneumonia.
Right.
When the virus gets into the lungs, there is a lot of fighting with the body is trying to fight. The antibodies are trying to fight, and there is that reaction which causes a lot of fluid destruction of cells from the lungs, and people get pneumonia. So they are using that antibiotic. It's a broad spectrum antibiotic.
Mhm.
That is the current treatment they are using for those who have it in the nursing homes.
Wow.
Yeah.
Okay, well, I think we have to wrap it up, but basically, thank you very much. I would like, if somebody is interested in jotting down the main points that, the sort of technical points or medical points that Esther talked about, I think would be good. I'll upload this as a file, but I think I cannot actually give it to you unless it's public, but I'm not going to advertise it only to you. And if you, okay, this is the second point. If you are interested in joining me discussing this matter on the basis of this tape that we actually have made, discussing this matter with Dr. Madden, I think it would be very good if you're interested to join us, to join me. So let me know if you're interested, then I'll shoot you the URL for the Zoom meeting we're going to do most likely toward the end of this week.
All right, sounds good.
All right, all of you, thank you for participating and good wishes to all of you. I mean, Teddy and Marilyn have had the virus, we know, and you are on your way out, and we're very happy that this is
They
happening.
survived.
And thank you, Esther. That was so great hearing from, the people that are really dealing with this. I think we don't realize, we hear all this stuff, but it's always best when it comes from,
From the hospital. Thank you, Professor. Thank you so much for listening, everyone.
Thank you again, all of you, and I will be in touch very shortly. And I'll see you actually on Thursday as well.
We'll see you on Thursday. Bon voyage.
Thank you.
you.